So something else that can cause shock if it gets too bad, but also something that's relatively common to see in the backcountry is bleeding. Okay. So how is it that we take care of bleeding? Um, we want to stop the bleeding and we want to do everything with clean, um, sterile wraps, bandages. We want to be using our PPE, right? Our gloves. Um, Now, it is important to know that if the bleeding is starting to spurt, okay, that means that it is, and it's not just like a steady flow of blood. That means that you've hit an artery, and so that spurt that we're seeing is someone's heartbeat. So every time the heart beats, more aggressive blood comes out. So this is going to be whatever you have to do. This is their life is on the line. Whatever you have to do to stop the bleeding, that's what you need to do. Okay. But if you see smooth and rapid bleeding from the veins and at the surface, this is also very serious. Anything you can do to stop the bleeding. Signs and symptoms of bruising. This is a signal of internal bleeding. Things to be aware of. So when we're doing everything, we are keeping things very clean. We're using only filtered and or sterilized water. Okay, so making sure to keep that. Um, Friendly reminder that if it's any sort of head injury, it's going to have a lot more blood than if it's a hand or some sort of abrasion. Okay. Sorry, we do want to clean this out, so don't want to just put something over it and bandage it up and be good with it. We want to flush out and then wrap it with that sterile dressing. Impaired objects, like you're seeing in figure 3, so maybe someone falls on something, maybe something falls on them. Do not remove this object, okay, unless it interferes with urgent first aid. So something like CPR, okay, something that has to do with saving the person's life right here and now. You leave the item in. This is a rapid evac, okay? So what you're actually going to try and do is control any sort of severe bleeding that's happening from this, and then put bulk of the dressing around the object to try to immobilize but keep it there. Okay, we want to reduce the size and weight of the object as possible. So if you have to cut part of a tree limb or cut something off while still keeping the majority of it inside the person, but it makes it easier to evac or to move someone, you can do that. Okay, remove any sort of small impaled object to the skin, like a splinter with tweezers or any sort of similar tool. Again, sterilize, sterilize, sterilized. Okay, leave the item in if it's large, like in figure 3, and it's a rapid evac to get that person medical treatment. Tourniquets. Okay, so there are commercial tourniquets, there are homemade tourniquets. We want to be very careful with tourniquets. The only time we would put on a tourniquet is if you can't stop the bleeding and it is arterial bleeding. It is gushing out and spurting all over, then yes, throw on a tourniquet at least a couple of inches below the joint but above the wound, like you'll see in figure 5, okay? And then make sure that on the person's leg, you write, well, in this case, the leg, but I guess it could be an arm or something else. And this is only something we would do on a limb. Write the time in which you applied the tourniquet. Never take the tourniquet off. It needs to be medically removed once it's been put on, okay? It is not recommended to do a tourniquet unless it is absolutely vital, all right? Most of the time when people put tourniquets on someone, they're causing more damage than they're helping. If that person is not going to die from that bleeding, you can cause serious problems and potentially removal of that limb under the tourniquet once you get to medical help, okay? Now you can carry commercial tourniquets with you, or like I said, you can make some um, with things around, and what you would do is you would twist it and make it as tight as possible until that bleeding no longer continued or the spurting stopped. Again, please only use tourniquets when it is uncontrolled, and that person will die if you don't put that tourniquet on, okay? Maybe you do this in a disaster situation where there's just you and 3, 5, 10 people that you need to help, okay? That would make sense. One person with multiple injuries, where there's two life-threatening injuries that are taking place, then yes, okay? If the person needs to move quickly because that's how we need to remove them from an unsafe scenario, yes, but under normal circumstances, you will not use a tourniquet. So as I was discussing, you're going to want to clean any sort of wound, and you want a high pressure stream of water, filtered water. I recommend that every first aid kit has a irrigated syringe, so that's what you'll see in figure 6 there. So by using that filtered clean water, you're going to irrigate that wound, and try and clean out any sort of debris that you'd find inside the wound. So that way you minimize the risk of infection. You can do this several times a day. This is only with water that is safe to drink. So whether you're disinfecting it through boiling, chemicals, filtration, or some other combination, only safe to drink. Okay, that's the only water that we use in any sort of backcountry scenario. Okay. If you don't have an irrigation syringe, you can improvise by using any sort of like biking water bottle that you can kind of cause pressure, and maybe melting a pinhole in the center of a lid so that way you can spray it, punching a pinhole into a plastic bag, whatever the case may be, okay? So make sure that you're flushing that out completely, and so the wound is completely clean before you continue. This is after the bleeding is controlled, right? Obviously, you're applying pressure prior to that point to stop the bleeding. Make sure that you wash your hands before, after, and wear your PPE. Okay, it's always recommended that you use latex-free gloves, which we talked about earlier, and then remove any large materials with tweezers before irrigating. How do you give care to these wounds? Steri strips, okay. Apply a thin layer of wound gel. Make sure that you're, again, keeping it clean, putting a dressing. If you have the steri strips, great. If you have any sort of sterile bandage, fantastic. If it's possible to completely cover the wound, then that's going to be our first choice. And then if it's possible to change the dressing daily, we'll want to do that as well. Okay. So these are laceration injuries that we are looking at in these pictures. Now, abrasions is going to be maybe you fall and stub your knee or something to that effect. Okay, so they're going to be more shallow, and typically they're going to be dirty, and so we're going to want to irrigate these and treat these the same way that we would something else. Okay, if you care within 10 minutes, apply a thick layer of wound gel and cover with a sterile dressing. Okay, if cared for after 10 minutes, then you're going to want to scrub the abrasion. I know it's going to hurt, but you need a gauze pad, a soft cloth, soap, water, clean water, right? Follow scrubbing with irrigation and rinsing. Right after that 10 minutes, now we start to have bacterial buildup, virus buildup, and we risk an infection. Okay? Apply that thin layer of wound gel and cover the dressing with a bandage. If in all cases, apply dressing for friction. So friction blisters blisters are friction injuries. So this is going to be a heat that's happening. They usually start as a soft spot, right? So we've all been there where we're in a new pair of shoes or another pair of shoes, and we're starting to feel that warm spot on our heel or on the outside of our toe, okay? The best thing you can do for yourself is fix the problem before there's a blister. Blisters end up ruining trips. They're painful, and once they are a blister, now they're a potential wound and chance for infection, okay? So you definitely want to clean around the site thoroughly, sterilize the point of a needle or knife to open the blister. If possible, leave the roof layer of skin. It's just one more barrier. So some people say, don't pop the blister. Draining the blister can help to prevent pain and can help the injury to heal quicker. Okay, you don't want to pop it, you don't want to peel off the skin, you want to leave the skin there, poke a little hole, drain it, clean it, and cover it like you're seeing in figures 10 and 11. Make sure that you're washing the blister with soap and water to keep it from getting infected. Always put this dressing. My recommendation is as you start to feel these blisters start to form, these hot spots, you get something called moleskin, and that will be a barrier that you can put as you feel those hot spots forming in your shoe to avoid ever getting the blister. We call that round thing a donut, and what it does is it just adds a layer, so that way your shoe is not directly on the blister causing pain from the pressure. So ear problems in the backcountry can absolutely happen, even at right at elevation or driving, we feel them, but any sort of infection can happen. So if it's due to objects lodged in the ear, do not use force to remove the objects. If it's small, attempt to rinse it out with water by flooding and draining the ear canal. Okay. For insects, use cooking oil instead of water. So if an insect goes in the ear. Okay. For ear infections, what are you looking for? You're looking for pain when the ear is pulled on. Okay, so if I pull on the outside of the ear, there might be pain deep inside my ear. Vertigo is when our balance and that dizziness starts to deteriorate, and that could be due to an ear infection. How do we give care? We want to rinse the ear out daily with 50% water and 50% alcohol or vinegar. This helps to dry out the ear and help to fix that that infection. If it continues, this can get very serious and you should be seeking medical attention. Nosebleeds are something that can happen as we get as it's really dry out or really cold out. The blood vessels in our nose and nasal cavity are very close to the surface, and that's to warm air as it comes in through our nose. And so we are more prone to nosebleeds because of that. So when you do this, you want to have the person sit down. Make sure that they don't lean their head back. Again, a common misconception. What we want to do is have that person actually lean slightly forward and pinch the meaty part of the nose just below the bridge to kind of help stop the bleeding. Hold or have the person hold their nose shut for 10 minutes. If the bleeding persists, have the person continue pinching the nose for another 10 minutes and repeat until the bleeding stops. Okay. Care for this as it's continued. If the person has suffered a blow to the nose, so it's not caused because of temperature or any sort of other issue, but it's because they were hit in the nose, check for any sort of deformity and care for the injury accordingly. Keep it ice, try and prevent swelling. Okay. If the person, ask the person not to blow their nose for 10 days, because it could restart the bleeding again. Those blood vessels are very close to the surface on the inside of our nose. Have the person seek professional help if within 10 days the nose was deformed by trauma. Okay, so it's pretty quick that we need to get treated for any sort of nose injuries. Tick bites, common in our area. So what are we looking for here? We want to remove the tick as quickly as possible. They have tick keys, so that can help pull up the tick, because what we don't want to do is have the tick, we don't want to pull off the body and leave the head inside. That can cause an infection. So how do we do this? We want to grasp the tick as close to the skin as possible. Okay, it's gross. I've been there, but this is what you got to do, all right? Perpendicular to the long axis and pull it out slowly using tweezers or gloved fingers, okay? So it happens slowly, the tick will come out, take your time. Make sure that you're doing tick checks each day in high tick areas, as we don't want the ticks to be on us for longer than 24 hours. Wash the bite area and apply wound gel to prevent any sort of infection. Make sure that you wash your hands. If you experience any flu-like symptoms within the 2 weeks of that tick bite, see a healthcare provider for evaluation. Their ticks carry something called Lyme disease. And so this is what you'd like, this is what you want to avoid if you start to feel sick. It could actually be the flu, right? It could actually be something, but go and see a medical provider to rule out Lyme disease. If the tick was attached for longer than 48 to 72 hours, the person should seek health care upon returning home. Once the tick is there for longer than 24 hours, or should I say longer than 48 to 72, the reason we do tick checks once a day is to avoid it being longer than 24 hours, is we're at a higher risk of that Lyme disease infection if the tick happens to carry Lyme disease. So venomous snake bites, when checking the person, what are you looking for? One or more fang marks with or without bleeding, localized pain, any sort of swelling, possibility of the entire limb is swelling, nausea or vomiting or tingling, shock, coma, or paralyzation, and then tissue death at the site of, okay? If we see any of these things, we need to get the person evacuated as soon as possible, okay? In our area, our biggest worry is rattlesnakes, but it can be, but other snakes can bite us as well. They just won't be venomous, okay? It is important to note that not just because you got bit by a rattlesnake doesn't mean that you're going to have a venomous reaction to the bite. So ideally, we would keep the person as physically and emotionally calm as possible to try and decrease the amount of decrease the heart rate, so that way there's not blood pumping quickly through the body, okay? Or quicker through the body. Make sure that we're washing the bite site. Apply an elastic bandage to slow the spread of the venom from the lymph nodes. Okay, so you should still be able to slip a finger between the bandage and the skin, and this should be above wherever the snake bite was. Okay, but below the joint. Keep the bite site lower than the person's heart. Do not cut the wound. Do not apply ice. Do not suction it out or try and suck out the venom or use a tourniquet. You need to quickly evac. You need to find the person help, and you need to document when the bite happened, what type of snake it was. If you know, don't go seeking after the snake, right? If the person, do not allow the person to walk, right? We're trying to keep the heart rate down. Make sure that you're checking for signs and symptoms of shock moving forward. So wound infections, we start to see any sort of pain, redness, or swelling comes from these infections. A small amount of light-colored pus is when it's at a mild infection. When it starts to get into serious infections, we see an increase in pain, redness, and swelling, increased heat, so it's hot to the touch. A lot of times the wound can become foul-smelling, grows darker in color. The appearance of red streaks under the skin is very serious. This is a rapid evacuation if you are seeing streaks coming from the wound, okay? Any sort of septic fever, absolutely quick evac as fast as you possibly can. If the person is still in mild, if the person is still in the mild category of infection, make sure that you're re-cleaning and redressing the wound, applying wound gel, and that you're monitoring for any sort of symptoms that lead you to believe it's becoming more serious. If the person is at a serious infection, or you have any reason to believe they're entering the realm of serious infection, re-clean the wound with water and apply the gel. Allow the wound to reopen to let it drain. Soak the wound in water as hot as the person can tolerate if you have access to this, right? Pack the wound with moist sterile gauze. Dress the surface of the wound with dry and sterile gauze. Re-clean and repack the wound twice a day. Monitor wound closely. And rapid evac. If the person has any sort of red streaks or systemic fever, it's a rapid evac. So More specifically, and our final slide here is evacuate slowly if the wound cannot be closed in the field. Okay, but it's not infected yet. We can hike out. We can leave the back country. A rapid evac if the person exhibits any of these symptoms. Okay, opens a joint space or body cavity, rapid evac. If there is any sort of tendon or ligament issue that happened, if the infection is caused by an animal bite, if it's a deep infection and on the face, if it involves any sort of impalement, and if there's any sort of crushing injury of bones or anything to that, it's a rapid go fast evac. It's also a rapid evac if the person is with the infected wound does not improve within 12 hours. Rapid evac. Okay. Anyone with signs and symptoms of a serious infection, like I just said, rapid evac. Get them out as quickly as possible. If more than one person breaks out and skin boils, evacuate as rapidly as possible. This may be a sign of group contamination. Okay, so if more than one person is exhibiting any sort of serious infection, evac as quickly as possible.